Gary Zuck had a kidney transplant 5 years ago, and this gift of life transformed his world. Now he dedicates his life to healthy living to support his new kidney.
Knock, knock. Well, who do we have here?
Oh
it is
gosh,
so good to see you. And your kidney's doing great.
Kidney's great.
And you look 20 years younger.
He's really made the most of his transplant and taken charge of his health and really took over his health care. And he's doing as well as any transplant patient could be.
Her work as the surgeon saved my life. Dr. Niederhaus is my superhero. She is my guardian angel, and she's a guardian angel to many transplant patients.
Dr. Silke Naderhaus brings a unique perspective to her patients, as she's both a surgeon and a patient who has had 2 kidney transplants.
I think for me, it's I was the patient first. And I think as a patient, you go through certain things that a lot of doctors don't realize. I think I know exactly what he's gone through and what he's going through.
It's astounding that a kidney transplant recipient is also a kidney transplant surgeon. And just to know her story is, it's astounding. She was a gift. She is a gift. Thank you for the transplant, Dr. Nita.
Oh, I wasn't the donor. I just put it in. It was my pleasure.
You're a guardian angel to many.
Oh, well, thank you. It's nice to see you again.
Nice to see
you. You take good care.
As a patient and a transplant surgeon, Dr. Naderhaus suspected her kidney was failing and turns to her colleagues.
I was a patient a long time before I was a surgeon, so I've always been a patient as long as I can remember.
I didn't know she had a transplant, and then when she told me her story that she had a kidney transplant, I was amazed how well she was doing, how she was able to function. And unfortunately, eventually, she started having problems with the kidney, and I had to become her doctor.
She knew that a living donor kidney was the absolute best option. And so we kind of put on our clinical hats and really focused on what the case looked like medically and surgically.
She is back to work. She feels great. She has a great attitude, positive energy, and she's like unstoppable.
I've noticed that the nurses have started entering information about what was said at the at-risk meeting into their lab reviews, which is really helpful communication.
In the last year, she's played this really special role of helping be our leader of our at-risk transplant group. And this identifies patients who are particularly complicated.
In this weekly at-risk meeting, improving outcomes for particularly complex patients are considered by clinicians from multiple disciplines.
I am a transplant hepatologist by training, and so what that involves is taking care of patients with liver disease who are undergoing evaluation for liver transplantation, and also involves taking care of patients after they've had their liver transplant.
Preparing for liver transplants involves extensive collaborations and planning.
By the time we get to the operating room, we've kind of gone through this exercise once intellectually in kind of our virtual reality world.
Dr. Nicole Shakur's research in Dr. Barth's lab examines the challenges of vascularized composite transplantation.
It looks like we have 100 cells in this slide. So, what do you think?
So it makes the question of how do we trick our bodies into tolerating this foreign material a lot more complicated when we have multiple tissue types in just one transplant organ. The technology for performing these transplants, the medications, the methods of measuring how the body responds to these transplants, it's amazing where the field has come in the last number of years.
For the faculty in this dedicated division and their colleagues, a daily reminder of the importance of their work is never far away.
You think that the person who may have donated her a kidney 30 years ago, if they had known that that kidney would facilitate a long and normal life where the recipient themselves became a transplant provider, a transplant specialist, it's really pretty awe-inspiring. So we don't necessarily need to go too far to find inspiration. She's made that very proximal to all of us every day.
When Dr. Slezak did her internship in surgery at Columbia Presbyterian Medical Center in 1981, there were 5 women in the program. In her plastic surgery group, she was the only woman.
Over the 30 years that I've been involved, there's more and more women going into surgery, and we have a lot of women in plastic surgery too. It's a new world. Certainly, I think that there have been tremendous strides made at Maryland in the visibility of women surgeons and the presence of women surgeons.
Hey, how are you? I am good. Good to see you. So good to see you as well.
For patients with a diagnosis of breast cancer, Dr. Slezak's skill as a plastic surgeon gives women back their self-identity.
Right, at 35 years old in 1999 is when I was first diagnosed.
It's a terrible diagnosis, and we can treat the diagnosis, but it's more than just treating the cancer. Obviously, that's a very emotional time for any woman, and it brings into thought not only of their own mortality, but what is their family going to be like. And in that time, you've got to explain to them not only their options for breast cancer treatment, but also for breast reconstruction. So there's a lot of education and a lot of information that we give and get from each other to know what they want to do. So how are you feeling after the surgery?
Well, you know, I feel great overall, but there are days she listens to you. She bonds with you, and she wants the best for you.
And look at you now.
With recent medical advances in treatment and reconstructive surgery, it's a new world for most women who can now live a quality life for many years with restored self-confidence and a positive self-image.
I'm a part of the breast multidisciplinary team.
The majority of our surgeries are done in conjunction, so on the same day. So typically it'll start with me doing the breast procedure, either where we're just taking out the area of the tumor, or we're doing something called a full mastectomy, where we're removing the entirety of the breast tissue. After we finish our portion, then the plastic surgeons come in and do their part of the reconstruction.
For medical school students, Dr. Slezak's experiences as a Vanguard have opened doors to a new world of opportunities in medicine.
I remember one of the moments that sticks out in my mind from first year is your lecture to our class and you talking about, you know, your path to become a surgeon.
Well, and thank goodness times have changed.
It was very inspiring that she was able to be, you know, the only woman in a career and succeed. I think that from Dr. Slezak's time until now, she's definitely helped pave the way. She is a fantastic mentor and exemplary of the kind of physician one aspires to be.
It's still going to be harder using some of those chest muscles.
I'm so sure.
But that's like...
I trust her with her opinions, and I do trust that she knows what she's doing. I trust her skilled hands. I trust Dr. Slezak truly with my life. With my life.
That's nice.
For Pooja, now a fourth-year student, medicine goes far beyond the required learning as she discovers a world of compassion.
I have a medical student working with me today. I wanted to introduce you.
I don't get a handshake yet, do I?
No, this is Pooja Patel.
Nice to meet you.
Nice to meet you too.
Pooja's been working with me all day, so she's just gonna kind of talk to you a little bit.
Great.
So Pat's a 38-year-old gentleman. We first met 4 years ago. He was flown from Carroll Hospital to the University of Maryland Medical Center Shock Trauma to the LRU. And there he was cannulated for ECMO pretty quickly because he was in acute respiratory failure and no one knew why.
So I'm just going to put this bell on your back and listen to your lungs. And so if you can for me, every time you feel it, breathe out of your mouth with a deep breath, okay?
Yep.
Say the letter E.
E.
Again.
E.
I think because of people like Dr. Shaw, I kind of saw role models, and Dr. Shaw was everything that I think I want to be.
The importance of our relationship is he saved my life. So I think that's about as important as it gets. Anything and everything that he says, follow his word because he's doing it right.
Yeah, exactly. Have a good rest of your summer.
You too, buddy.
Say hi to the fam.
See you.
I saw how you interacted with him. It came so easy to you, and you know I feel like that personality and that ability to make him feel at ease was really nice to see. You did a really nice job.
I really felt like I was meeting a celebrity based on the story you told me about him.
Pooja is awesome, and I recognized in her immediately this goal of wanting to connect to her patients. So obviously I think that, Pooja, you're on a track to be incredibly successful. What I think is important is to never forget kind of where you came from. Never forget how that shaped who you are today. I'm proud of you. I think you're going to do phenomenally well. Keep it up and keep working hard. You're welcome.
For Pooja, in her heart, India is always home, with fond childhood memories of love and extended family, and a very different way of life.
I was the first person in my family to go to college.
Not knowing how she would be received in medical school, Pooja discovers a new world where she's both accepted and valued.
I think that both as a woman of color, and as just somebody who came from a different background, I feel really at home at Maryland.
Pooja is a great example of someone who came to medical school not having people to look at around her that had achieved a similar goal, and was given an opportunity because of who she is and because of what she stands for.
Really, within a day, I pinpointed that she would be the star of the show. She was naturally empathic. But this is really amazing. She's a great conversationalist. And so not only did that make it very easy to communicate with her and give her feedback regularly, but it translated almost instantly to the rapport she had with patients, which I'm so proud of.
I'm so happy I got to meet you.
This is like all the way out there in the stratosphere of what students do.
It's a lot, yeah.
This is amazing.
I'm gonna cry.
No tears. Remember I told you, please.
Now fluent in 2 cultures and 2 worlds, Pooja continues to honor her roots and bring with her perspectives that enrich both communities.
I'd find every chance I got to go back home to India to see my family, to see my grandma. I think they're just kind of proud that I was able to do what I did, and part of it is because they kind of helped me get there. So what's wonderful about the School of Medicine faculty is that they appreciate us for being different, and they teach us to keep that unique part of us alive throughout our learning process, and I can't help but feel indebted to this university for, opening its doors to people of different backgrounds, of appreciating us for being different, and kind of cultivating an environment where we feel okay speaking out and wanting to keep things moving and changing along with our generation.
As a neurosurgeon and a visionary physician-scientist, Dr. Woodworth creates a bridge from the OR to the bench, leading his research team in a quest for innovative treatments.
The laboratory is a bridge between the current age and the modern future age. We get to test all of these things and develop the language, develop the ideas, and think about where things can go.
We all work in Dr. Woodward's research lab, which is called the Translational Therapeutics Research Group. And it's a very exciting lab to work in because we have a number of research projects that span the preclinical to clinical spectrum.
It's really exciting because we get to work with Dr. Woodworth, who's in the surgery room all the time. So he tells us, what's going on up to date. So we can kind of translate that back into our research.
We're working on developing drug-loaded nanoparticles for the treatment of various brain tumors.
Whatever we do on the bench, we hope to see it being applied at the bedside one day.
I'm the only biomedical engineer on the team, so I add value to this group.
I just joined this lab and I'm very excited and I cannot wait to start the journey with this new family.
One of the really great things about working in the lab as a medical student is getting exposure to the breadth of research that our institution has to offer.
The team has to come together carefully and slowly and thoughtfully, but the most important thing is that everybody else gets to share in the vision, because no one person has all the answers. If you look at the blood vessel in the brain, there are numerous components to the blood vessel wall, the structure that separates the bloodstream from the brain that you don't see in other parts of the body.
These characteristics inhibit the delivery of therapies to treat glioblastoma, the most common and deadly brain cancer, as well as other brain disorders. Dr. Woodworth is dedicated to discovering how to make this possible.
We are the first site in the United States to be testing blood-brain barrier disruption for patients with brain tumors. So the ultimate goal of opening the blood-brain barrier right now is to deliver therapeutics into the brain for brain tumors where the therapeutic modalities that we currently have either not worked or haven't been able to get into the brain for one reason or another. So this is before the surgery and before the ultrasound. This is a target area. This is after ultrasound, before the surgery, showing the new blood-brain barrier disruption here and lack of any evidence of hemorrhage or damage here. It's suggestive that we safely open the blood-brain barrier without creating injury. Our vision and our hope right now is that we can have the tool approved as a tool for drug delivery and for other things and not have it be limited to a specific drug.
For 15 to 20% of patients, the promising technology of ultrasound may not be an option due to their unique skull characteristics.
The motivation of this project really is that some of the patients have a skull density ratio that doesn't permit them to be treated with focused ultrasound.
With a simple surgical outpatient procedure, Dr. Woodworth hopes to enable these patients to also take advantage of ultrasound as a tool to open the blood-brain barrier.
What we've come up with is a strategy where we would make a small acoustic window through a patient's skull, again through a small incision as an outpatient procedure, and then that patient for the rest of their life could have this type of ultrasound treatment. It would basically convert their skull into an ultrasound permissive skull from one that was not. You guys are always welcome to come to that, by the way. It's on Wednesdays at 4 o'clock in the Cancer Center.
With his extraordinary team, Dr. Woodworth explores ideas to transform the treatment of brain tumors.
And in the end, the most valuable thing I find in the laboratory, in terms of building a bridge to the future is, the ideas may be good, they may be really good, but in the end, they may be wrong. It has to be the truth. Science is about searching for the truth.